Hello, may I know who joined for Doctor for a day? Is anyone here for Doctor for a day? Okay, let's wait 2 more minutes. I will see and confirm who's joining. Okay, let's go ahead and get started with the event. I think you should be able to see my screen. Welcome to Doctor for a Day. You, the viewer, are going to serve as a doctor in a fictional hospital where you'll get to learn about the roles of different types of doctors, and then you'll be able to participate in different activities to kind of act like a doctor. So let's go ahead and get started. So, first of all, welcome. You and whoever you're watching this with, you're going to become a medical team of different types of doctors. And we'll be learning about what the jobs of all these different types of doctors are and how you can apply this to real life. Disclaimer really quickly is that all of this is for educational purposes only, and do not disregard professional medical advice for anything on Parinama Academy and live stream. Thank you. And let's go ahead and move forward. So, first of all, let's talk about cardiologists. So, they're the type of heart doctor that'll look at your heart and your blood problems. They'll examine how exactly your heart is beating and how blood is traveling through your body. This is a picture of your heart, and this is a picture of the blood vessels, which are kind of like straws or tubes that transport blood all throughout your body. And these blood vessels are everywhere. If you look on your arm, you might be able to see blue or green lines. That's going to be your vein, and that's a type of blood vessel. And they will look at machines called EKGs, which show the heart rate of your heart and show how fast it's beating and expanding and compressing. Um, and they'll just make sure that it's working properly and that you're staying healthy. Next, we have orthodontists. They're the type of doctors that help straighten teeth, and if you've ever seen a problem where somebody's jaw isn't quite aligned, or if their teeth aren't that straight, they may need something similar to braces, expanders, etc., where they can help get it fixed. And that's mainly the job of an orthodontist. Now, a quick thing is that they shouldn't get mixed up with dentists because dentists are what you would normally see for regular teeth problems, like a cavity or like a minor surgery. Orthodontists specialize in more of the braces and that type of thing. And they'll examine your teeth and look for anything very specific where you would need more specialized care for it. Next, we have an EMT or an emergency medical technician. They are basically the trained responders that if you've ever seen an ambulance, they'll be some of the people on that. They'll go onto the scene where you got injured and they'll help make sure you get treatment immediately, and then they'll take you back to the hospital where you can get treated more thoroughly. And then we have radiologists. They'll be looking at x-rays to see if there's anything wrong with your bones, maybe if they're broken or malformed, if there's some sort of fracture. Use these machines called MRIs or x-rays or CT scans. All those types of things use a specific type of light that lets them look inside your head or inside your body and kind of look at the bones inside your body without having to obviously like cut anything to look inside. And then we have a surgeon, which is a doctor that performs operations to go and look inside your body to help fix something. It's like especially if you have a broken bone or something like that, you can't really fix that from the outside. You have to kind of make a cut and then go in your bone. So that's kind of what a surgeon does. And obviously they have procedures where this doesn't hurt or it minimally hurts. They have medicine and things that help make it much better. So yeah, it's not something to be scared of, any of these really. It's something that I think is really cool and fascinating, and it's really interesting to learn about as well. So, I don't think anyone has any questions, so let's just move forward. So a quick recap, a cardiologist is for your heart, orthodontist is for your teeth, EMT is just in general anything related to emergency medicine. A radiologist is for your bones, and a surgeon kind of performs various types of surgeries within your body. And now let's do some trivia. So now that we've learned about the different types, you could try to figure out what type of doctor would be needed in each of these scenarios. So this is the first scenario. So Sparky walked into the hospital with a toothache. What type of doctor took an x-ray of his teeth and figured out that he needed braces? So take a second and think about it. What type of doctor works with the teeth and tries to figure out what's wrong with the teeth? If you said orthodontist, then you are correct. Okay, next scenario. Oh, this one, you have to try to figure out which two doctors are going to be helping out here. So Rocky accidentally swallowed one of his toys. A blank doctor takes an x-ray of his stomach to find out what it is, and a blank doctor then performs surgery to take it out. So which two doctors do you think are going to be involved here? Take a second to think about it. And if you said radiologist and surgeon, then you would be correct. So if we go back here, a radiologist would be the one that takes the x-ray, and then a surgeon would be the one that actually performs the surgery to fix or take out whatever's wrong with the body. Okay, let's move forward. So, scenario 3. Molly just called and said she's stuck under a machine at a construction site. A blank doctor has to go find and rescue her. So, first of all, which type of doctor do you think would be used here? Take a second and think about it. Okay, if you said an EMT, then you would be right. And now let's try to serve as an EMT really quick. So what you can do is you could pause the video if you need to look around, see if you can find the person that needs help over here. I'll give you a couple of seconds. And then, okay, reveal in 3, 2, 1. The person who needs help is right there. So the EMT can go and get an ambulance, help make sure they're okay, load them onto the ambulance, take them to the hospital to get them the proper care that they need if they're injured. So yeah, the answer there would be EMT. Okay, so a blank doctor looks at how fast Nestle's heart is beating and sees if anything's wrong. So first of all, what type of doctor do you think would be applicable here? Take a second and think about it. Okay, if you said a cardiologist, then you would be right. Now let's do a quick activity to figure out if we could figure out how our heart is beating. So let's try it. So first of all, what I want you to do is hold out your left hand and find the circled spot right there. So it would be this little spot. And then next, you're going to put your right hand behind your left hand. Ooh, I can't really do it right now, but you're going to put it behind your left hand like this. And then your fingers, these two fingers, they're going to wrap around, kind of find the small cavity right there. It's like a little bit of a hollow area near near your carotid artery. I think that's what it would be here. And this is where blood is pumping really fast. And this is how you could kind of measure your heart rate. So, Kiran Kartikeya Rao, are you here for the doctor for a day? Yes, okay. So here, I can go back a little bit. We've already started, but I could go back. Um, let's quickly do a recap of all the different types of doctors we talked about. So, first of all, welcome. This event is where you can kind of learn about the different types of doctors, and then you'll be able to kind of serve as your own type of doctor, and you'll be able to solve medical cases, kind of fake medical cases, and you'll be able to apply what you learn to what we're doing today. So, let's go ahead. I'll quickly review. So, a cardiologist is the doctor that kind of talks about the heart and the blood vessels. They'll monitor your heart, see if anything's wrong and if anything needs to be fixed. And an orthodontist is they're kind of a specialized type of dentist where they don't really work with like common teeth problems, but if you have misaligned teeth or if you need braces or anything like that, that's when you would see an orthodontist, and they kind of serve a more special purpose in that sense. Um, Ria Shinish, are you here for Doctor for a Day? Yes? Oh, okay. Now we have some more people joining. So here, you know what? I'm gonna see. Let's actually no, I think I'll go ahead and keep going. Um, so I did go ahead and go forward, but we can restart. That's okay. I'll go ahead and restart. So basically, first of all, welcome. You're going to be a medical team of different types of doctors, and we will get to learn about the different types of doctors and what they do, and you'll be able to apply this knowledge to real world scenarios that I've kind of created for you guys, and you get to kind of solve medical mysteries just like that. One thing to keep in mind is if you actually talk to a real doctor, do not disregard their advice for this because ultimately a real doctor is going to be better knowledgeable. This is just to help you learn, but again, do not disregard professional medical advice from everything you've heard today. Yeah, so let's go ahead and get started. So we're going to learn about 5 types of doctors, okay? Just 5. Um, so the first one's going to be your cardiologist. That's going to be the doctor that works with your heart. So this is kind of a picture of your heart right here, as you can see. It's the central area where all of your blood vessels are going to connect. And speaking of blood vessels, this is kind of what a blood vessel is. It's kind of like a tube or a straw that blood moves throughout your body. So if you want to look actually on your hand, you might be able to see on camera, it's not really going to show, but I have kind of blue lines running along your wrist, like right there. That's actually one of your blood vessels. That is called a vein. And that is something that your blood can flow through. So, yeah. And then next we have orthodontist. So keep in mind, these are not the same thing as dentist. Orthodontists are more of a specific type of dentist, if that makes sense. They go through more schooling. They have to go through an extra school to basically become an orthodontist. And that extra school allows them to, if you've ever seen your friend have braces, I'm sure you know a lot of people with braces. Um, they kind of do surgeries like that to help fix your teeth. If there's a larger problem than just a cavity or something like that. If it is a small problem like a cavity, that'll usually be a regular dentist that fixes that. And then you have an EMT, which is an emergency medical technician. Now, that sounds like a lot of words, but basically, all that means is that what they'll do is they're kind of trained to do a lot of things, but their main purpose is to go on scene. Like, if somebody's injured and they're not able to go to the hospital by themselves, these doctors, they'll go and they'll get an ambulance and they'll grab these injured people, make sure they're okay, help give them any care they need and then get them onto an ambulance to the hospital where they can be cared for more properly. And then we have a radiologist, which kind of uses medical images. And medical images are basically, it's like a type of machine it casts a specific type of light into your body. And that light will pass through everything else, but it reflects off of bones. So when light reflects, it becomes this kind of lighter color. So you can exactly see where the bones are. And they'll use these types of images to see if anything's wrong with your bones, if you have a fracture or a broken bone or anything like that, then that'll kind of help them know how to fix it. Okay, and next we have a surgeon, which is a doctor who performs operations. So I don't know if you've ever seen an operation or heard about one, but they'll kind of be the ones to, if you have anything wrong inside of your body, they'll kind of make a cut and then they'll kind of go inside your body, fix it, all up and then you can kind of recover like that. This happens when you have something going on inside of you that can't really be treated with medicine, like if you've ingested a toy or if you have a broken bone or anything like that. Um, let's see, Ritvik, are you here for the event today, Doctor for a Day?
Yes, I'm here.
Yes? Okay. So I just went through the different types of doctors with all of the other kids. Uh, and I can go through it one more time just for Ritvik really quickly. So a cardiologist is a doctor that kind of looks at your heart. They're going to see how the heart is pumping and if there's anything wrong with it. An orthodontist is the type of doctor that it's not a dentist, it's more specific than a dentist. They'll actually do specific types of operations with like braces and stuff that'll help fix more complicated problems with your teeth. And then you have an EMT or emergency medical technician, which sounds long and complicated, but really what all it means is that they're an emergency responder that'll kind of go on scene if you're ever injured and you can't take yourself to the hospital. Um, and they'll help you get better. And then a radiologist is the type of doctor that uses x-rays, MRIs, all that kind of thing. It's like basically they're specific types of machines and they'll kind of throw light at your body and then the light passes through your skin and your muscle and everything. But then since your bones are solid, it's going to reflect off of your bones. So as you can see here, the light's kind of reflecting off the bones, which makes them look lighter, which is what an X-ray does. And this helps them kind of see if there's anything wrong inside of you. And then there's a surgeon who performs operations to fix injuries or like anything inside of your body, really. If you have a broken bone, if you've swallowed something, then they'll usually be the ones to fix that. Before we move on, after this we have kind of an interactive part, so I just want to make sure we have a good grip on the concepts I just discussed. So is everybody good with what we just learned about?
Yeah,
Yes? Okay. Let's keep going then. So yeah, really quick recap. A cardiologist for the heart, orthodontist is for the teeth, EMT's emergency medicine, and then a radiologist is going to look at your bones, and a surgeon kind of performs a variety of things inside your body. So let's do some quick trivia. Let's see what you guys know. This is the first scenario. So imagine that a little boy named Sparky, he walks in the hospital with a toothache, and there's a specific type of doctor that's going to take an x-ray of his teeth and figure out that he needs braces. So what type of doctor do we think is going to do that? I can go back here if anyone needs. So just think about it for a second, kind of figure out. Yes, good job, Ritik. It'll be an orthodontist. So they're going to be the ones that look at your teeth. Yes, good job. Nice job, guys. Okay, next one. So, a little boy named Rocky swallowed one of his toys, and this time there's going to be two doctors involved. So, the first doctor is going to take an x-ray of his stomach to figure out exactly what it is and how to get it out. And then another type of doctor is going to perform surgery to take it out. So here, let's go back. I just want to make sure you guys know how to like spell it and everything. But which doctor is going to take an x-ray and then which doctor is going to perform the surgery? So just think about it for a second. Try to figure it out. Yeah, nice job, Ritvik. Okay, I think we all got it. So for those who don't know, the answer is going to be a radiologist and then a surgeon. Yeah, nice job. So just once again, a radiologist is going to be the one to actually look inside to see what's wrong, and then a surgeon is going to be the one that performs the operation to take it out. And then scenario three, Molly just called and says she's stuck under a machine at a construction site. So what type of doctor is going to go rescue and find her? I can go back here if you guys would like, just to see the spellings. Yeah, nice job. Okay, so for those who don't know, it is going to be an EMT over here. Now, let's try to see if you guys can be a good EMT and try to find Molly. So we're going to go to the construction site and you have to try to find her, okay, guys? So just take a second. We're going to look. Can anybody see Molly? Yeah, there you go, Ritzvik. So it looks like Molly's trapped under the truck. So what would happen here is that, oh, what would happen here is that um, EMT would go on site, help her get moved onto an ambulance while making sure that she doesn't get injured any more than she already is. And then they'll kind of treat her, make sure she's okay enough to be transported to the hospital. And then in the hospital, they'll do better care to make sure she fully heals. Whereas an EMT just makes sure she's kind of okay to go to the hospital, if that makes sense. So yeah, answer there would be an EMT. All right, next scenario. A blank doctor looks at how fast Nestle's heart is beating to see if anything's wrong. So let's go back to the spellings. I know spellings can be a little bit difficult, but just try your best. What kind of doctor is going to look at someone's heart? Yeah, there we go. You could think about it for a second. Yeah, nice job. Okay, so nice job, Ritik. It's going to be a cardiologist. Oh, cardiologist. So now let's try to be our own cardiologist. You could try actually to at home, you could figure out how fast your heart is beating. And that's because right here in your wrist, there's actually a little artery that runs right there. And you can kind of put your finger on it and you could kind of feel the blood flowing through it. And we're going to try to do that today, okay? So here, this is a quick activity if you guys want to do at home. So first you're going to hold up your left hand and then find the circle spot, which is going to be you have your thumb and then you're just going to go down and it's like this wrist area right there, right under your thumb. And if you can feel it, there's kind of like a cavity there almost. Like you could see it pretty well on mine. There's like a little hole there almost. And that's where you're going to kind of put your fingers after. So after this, you're going to take your right hand and it's going to go behind, just like this. Now, it's a little bit difficult to show on camera, but it's going to go kind of behind like that. And just keep in mind, you're going to use these two fingers, your pointer and your middle finger. They're going to be used to measure the heart rate. So after this, you have your fingers here, and they're just going to wrap around your wrist just like that. And then just be gentle, don't press too hard, but you should be able to feel kind of a bump that's gonna go pretty fast. I would say it goes pretty fast. Um, and if you could feel it, it's gonna go bum, 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 and that's gonna be your pulse. So that's basically your heart pumping blood through all your blood vessels, which we talked about earlier. So if you want to, you can obviously participate in this. So you're going to keep your fingers there, and then when I start the timer, just count how many bumps you feel, and then I'll let you know when to stop, and then I'll help you calculate your pulse from there. So ready? Let's put, if you want to participate, you could put your fingers right there, and then just be ready. So let's start in 3, 2, 1. Okay. Okay, I counted about, I think 19 is what I did. Um, Anyone want to share if they did do it? You can totally go ahead and share how many you just got. 19 as well? Yeah, okay. Um, so yeah, that's kind of the first step to calculating your heart rate. So heart rate is actually calculated by the number that you will get at the end, which will help you calculate, that's going to be your number of saying basically how many times did your heart pump per minute. So like in a minute, how many times was it pumping? Um, so to do that, we just did it for 15 seconds. And if you multiply 15 by 4, that's 60 seconds, which is a minute. So that's why whatever number you got there, which for me and Ritvik and maybe some of you guys could be 19, um, we're going to multiply that by 4, and then that's going to be our heart rate. So 19 times 4, let's see, that would be 76. If I believe, yeah, 76. So that would be my heart rate. And a normal heart rate is going to be about 60 to 100 beats per minute. But keep in mind, it could be a little bit like iffy because, especially, this is something you could also try. If you just do 20 jumping jacks or something like that, like if you do a lot of physical activity and then you try measuring your heart rate, it's going to be higher because your muscles are working harder, so they need more oxygen. And then your heart's going to pump more oxygen rich blood to all your muscles. So then your heart's going to be beating a little bit faster for that. And then it could be higher than 100 beats per minute. And that's not something to be scared about. It's a little bit worrisome if it's constantly above that number, but usually it's fine if it's just for physical activity. Again, please do not disregard professional medical advice for this. This is, again, purely for educational purposes, but just some general interesting facts to know. So yeah, the answer for that would have been cardiologist. So if you got that, great job. And then here, let's take a quick 2-minute break because I know it is the middle of the day. If you have anything to do, maybe bathroom, get some water if you need. We could just take a quick break for like a minute. We could start back at 1:12. Um, or if no one needs a break, that's fine too. Okay, let's keep going. I think we should be good to go. Um, so if you went anywhere, then welcome back. Let's keep going. So now what we're gonna do is I think most of you guys should kind of know what each doctor does. That trivia was to help prepare you for this case you're gonna work on as kind of a team. So, yeah, let's just go ahead and get started. Um, so let's imagine that a boy named Bobby, this is Bobby, okay, but we have to find him. He's lost in a dangerous forest. Um, so who do you think will do this? Who are we gonna send after that? Just take a second to think. Okay, if you said the EMT or emergency medical technician, then you are right. They're gonna be the ones that are gonna go hop in an ambulance and go right to the forest to try to find Bobby, okay? So here, now we are going to be the EMTs, okay? So be ready. You have to use your observation skills. Try to find Bobby in the forest, okay? So let's see. Can you find him? Just take a second and look. Yeah, there you go, Ritvik. He is in the tree. So yeah, seems like Bobby got stuck up in a tree and he might be hurt. So the medical technicians are gonna go reach up there and make sure he's okay, take him down, and then he's gonna go on an ambulance ride to the hospital. So now let's take him back to the hospital, okay? So we rescued Bobby, but he's crying and he won't tell us what's wrong. And it's gonna be our job to figure it out, okay? You guys are the doctors and you're gonna try to figure it out. So, since he was up in that tree for so long, we should probably take an x-ray to see if he has any injuries, if he got hurt or a broken bone or anything. So, who do we think will do it? Just think for a second, keep it in your head. Okay, if you said the radiologist, then you are correct. A radiologist is going to use those special images and machines we talked about earlier to kind of perform an x-ray of his whole body to see if there's anything wrong. So this is the x-ray that the radiologist sent us. So you're going to be the doctors. You need to figure out if there's anything wrong with the bones. Does anything look wrong over here? Just look for a second, see if you can see anything. And yeah, nice job, Ritvik. The tiny bone over there is broken. The thin one on this side right here. You can see there's a little fracture over there. He probably hurt it while he was trying to climb up that tree. So oh, poor Bobby, but let's go into surgery and we can fix it for him, okay? So now you guys get to be the surgeons and you're gonna fix it. So, we need someone to go and fix his broken arm. So, what type of doctor will go do it? Take a second and think about it. Okay, if you said a surgeon, then yeah, good job, Ritvik. You are correct. I did accidentally say it earlier, but it's okay. So a surgeon is gonna go and they're kind of gonna create a little incision where they can see the bone and they can help put it in a way where it can heal properly, or they sometimes may add something else in there, like a brace to help it heal properly. It really depends on the type of fracture because if you don't know, there are also different types of fractures. Like it could be kind of like a bunch of tiny pieces, it could be just a fragment or like anything like that. There's different types of fractures, which we could probably talk about another time, but yeah. So a surgeon is going to go and fix that. So now we are in the operating room and you're a surgeon, but wait, you just realized an important thing. During surgery, we have to make sure that his heart is beating properly, right? Because we don't want to lose track of his heart, and then while we're trying to fix his arm, his heart stops working. So, who is going to look at the heart? Take a second and think about it. Yeah, the cardiologist. Nice job. You spelled it right too. Good job, Ritik. Um, so yeah, they're going to look at the heart during the surgery. and they're going to make sure that it's working properly. And then this is Bobby over here. He's trying to get his bone fixed. So yeah, now his arm's all fixed. If you could see here, he has a little cast over there. And if you don't know what a cast is, it's basically after you do a surgery to fix it, you want to make sure your bone or your arm doesn't move that much afterwards because that can kind of ruin the whole surgery and healing process. So what they'll do is they'll create kind of a hard case kind of called a cast, and it's gonna basically cover your whole arm and prevent it from moving too much. So that way the bone can heal without being moved. Um, yeah, so that's basically what he has right there. And this doesn't just happen on the arm, it can happen really anywhere, like in a lot of places. But yeah, so his arm is all fixed, but if you do notice, he's still crying. But can we see what he's pointing at? I think he's pointing at something, guys. Try to figure out what he's pointing at. Maybe something's wrong there. Let's just take a second, think about it. Okay, if you notice, he's kind of pointing at his mouth over there. Maybe something's wrong. So let's call in another doctor. So maybe something's wrong with his teeth. So we could take an x-ray of his teeth and figure out what's wrong. So who do you think will do that? Just take a second, think about it. Yeah, nice job, Ritvik. It is quite a difficult one to spell, but yeah, you mostly got it. Um, so an orthodontist. Okay, keep in mind, even though it does say x-ray, X-ray isn't always going to be a radiologist, especially in this case where it's more about the teeth, right? So that'll be kind of your dentist or your orthodontist or anyone like that if it's involving the teeth. So just a thing to keep in mind. I thought that was something important to add, but yeah. So let's call in our orthodontist, which is you guys, and you're gonna take a look. So you're gonna perform your little X-ray machine, psh, and then this is kind of what you got. So if you notice, this is what a normal one would look like. A normal x-ray and then his normal mouth. You kind of just look at his mouth. And then this is what Bobby's looks like. So do we see anything that is wrong here? Just take a second and observe. Okay, now let's move on. So, oh, he broke a tooth, which messed up his bite. We could go back here and see. This tooth is kind of broken. This one's also not looking great. They look a little strange, which probably was why his tooth was hurting and his mouth was hurting, and he was crying so much. And sometimes, if it's a really serious fracture, it could mess up the bite or the alignment of your other teeth as well. So if you notice here, this normal teeth, they're perfectly straight. But then this one's kind of misaligned. This top part is going more towards the left, and this top part is going more towards the right. It doesn't make sense. It's more like that. So yeah, that's not normal, and we don't want that. That probably happened when he was up in the tree. He probably hit his tooth on something, and then it kind of messed up his teeth. So after that, the orthodontist can go in and fix it, and then he's gonna be a smiling little cute little guy. So that's Bobby, and he's all fixed and healed, and oh, he's really happy. I think he likes you guys. So yeah, good job, guys. You did really great on that case study. So, do we have any last questions about these type of doctors or anything? Um, thank you guys for joining. That was really fun. I hope you liked it, and uh, if you do, I could probably do more case study type of things in the future. I think this is really cool if you get to kind of act like the doctors and try to figure out what exactly is wrong. Okay, I think we are good. So, thank you for joining. I hope you had tons of fun. Oh, thanks, Rithvik. Yeah, I enjoyed telling you about this. I hope you enjoyed listening and hearing about the different types of doctors. I hope this convinced you to kind of look into a career in medicine because it is really truly a fascinating thing. And I myself am studying like medicine in high school right now, so I hopefully do want to go into that path, and I hope this kind of creates more options for you. Yeah, so thank you guys for joining and have a good day. Yes, of course. Thank you for joining.